So how do we prepare for the day of surgery? Bismillah ar-Rahman wa salatu wa salam ala Rasulillah. So in our last video, I explained to you how in the week before surgery, you have a regular exercise, you follow a low carbohydrate, low sugar diet, and you do these breathing exercises. And now on the day of surgery, you've arrived in the hospital after fasting for 8 hours without eating or drinking, and you've come in the morning for surgery at the time you've been told. So the first step is you'll be going to the admission office. What is the admission office? It's where the hospital clerk completes your file, makes sure you're in the system, gives you a file number, puts all your documents together. Then once your file is complete, they take you to your room that's been assigned to you. So the second step is you arrive in the room that you've been assigned. So when you get to your room, your nurse welcomes you. She looks at your file, completes your documents, makes sure everything's in order, gives you your clothes to change. You wear these special hospital clothes called a hospital gown. And this gown is made of special material that will make you feel comfortable and make it easy for the surgeon and the healthcare team to provide you your care that you need. Once you've completed that, the nurse makes sure that your file is complete, and you are then transferred to an area called the pre-operative area. So the third place you'll be going to that day is the preoperative area. So what is it, the preoperative area? This is a place that will come just before surgery, where the anesthesiologist, the surgeon, and the operating room nursing team get to meet with you. Everybody confirms the procedure you're going to be having. There's a special safety checklist that we have to go through to make sure that you have a safe operation. Once everything is done in the preoperative area, and the safety checklist is complete, we then transfer you to the operating room. So the fourth place you'll be going to is the operating room. In the operating room, you'll be transferred to the operating room table. The anesthesiologist connects you with all these special monitors to look at your heart rhythm, your blood pressure, and then they give you some oxygen and some sleep medication to help you get some sleep. You'll be having your surgery in the operating room, but you won't know about anything. And when you wake up, you'll be in the fifth place, the recovery area. So in the recovery area, you'll have some oxygen connected to your nose. You'll have these monitors connected to your body. You'll wake up, and the nurse will be around to help you with getting comfortable. If you feel pain, she'll be there to give you some pain medications. If you feel thirsty, she'll be able to give you some sips of water to feel better. And we keep you there for a few hours to make sure that you've recovered safely from the anesthetic. After finishing about 3-4 hours in the recovery area, you get transferred back to your room where your family is waiting for you. So in your room, you get to rest on your bed. Your family is on your bedside. Once you feel more wakened up and less drowsy, the nurse helps you get out of bed, go to the bathroom, walk around in the halls, give you the spirometer again to do some breathing exercises, and if you feel well, we start using with some clear liquids. So clear liquids on the first day after surgery include apple juice, water, green tea, broth. You get to sleep that night. The following morning, I'll be visiting you again, making sure your parameters are all okay. You'll have a blood test done to make sure you're doing well. And then the dietitian will come and visit you and discuss in detail your diet plan. You'll be feeling much better the following morning. You'll be feeling as if you're getting back to normal. You'll be feeling as if you're able to tolerate the liquids better. And once you feel that you're ready to go home, we discharge you. So simply speaking, bariatric surgery is about doing some preparations before surgery, getting your surgery done, and then recovering in the hospital for 1 or 2 nights. It's got some small holes with waterproof dressings. You're able to take a shower after surgery. You start walking around after surgery. There's some mild pain that's easily controlled with pain medications, and then you're on a special diet and you're connecting with us for your transformation towards weight loss. So here's the conclusion. On the day of surgery, you got to the admission office, you go to the preoperative area, you have your surgery, you're in the recovery area, you get to your private room, you recover in your private room for a day or two, and then you get to go home. You come back for a follow-up after a week, and if everything's okay, we stay in communication for the rest of the year to make sure you have a safe weight loss journey. We look forward to you having a pleasant stay. This is Dr. Tahir Yunus, board certified in the USA, bariatric surgeon working at Evercare Hospital, Lahore. Thank you very much.